Just like that. End of 13th over, 22 for 2.
Look at the difference. The economy and also the wickets column. 2 for Asif, but make no mistake, all of them have bowled well.
Well bowled on the hard length again. Asif is coming back a bit. Just opening, just bending his back, showing his pace.
He's a big, tall boy, Asif. He's very athletic as well.
Ideal figures for him. 2 for 4.
No! Once again, inside edge. This time takes the leg stump. And Central Punjab are reeling. Asif on fire.
The second one, inside edge to the stump. That happens when you have pace, when you bowl in the right areas, and just a back of length. Came back in sharply. He had to stop him, but it was difficult ball to negotiate.
Yeah, the best of the lot from Asif. Really jacked back in sharply. And Saad, who's good on the back foot, couldn't cope with it. Gone for a duck. Central Punjab, 22 for 3.
When your bat hangs, then this happens.
What a first hour after lunch we had. Central Punjab, 22 for
420D
3.
फोल्डिंग आयरन का रिव्यू करेंगे.
Hello and welcome to this Roche Global Life Talk. It's part of a series of events bringing people together to discuss some of the biggest challenges facing us today in healthcare. I'm Nisha Pillay and I'm pleased to be your host. Our topic today is where you live should not determine if you live. In other words, it's all about improving access to healthcare. Our conversation is going to be led by three really powerful healthcare champions. Let me introduce you to them. From India, we will be joined by Dr. Ratna Devi. There she is in the far right-hand corner. Hello, Ratna. Muniba Mazari is in Pakistan, in Islamabad. And we have a world-famous musician, Apple Ab, part of the Black Eyed Peas group, joining us from LA. Hello to you all. And listening in to our conversation is the chairman of Roche himself, Mr. Christoph Hans, who's going to be watching and joining in and drawing our conversation to a close at the end of our meeting live from Basel. Good morning, Chairman. Now, thousands of people have shared their thoughts with us already. Before we get going, we want to make sure that you join into our conversations too. We're going to be hearing from our advocates. They will share to us their motivation. They're going to share with us what brings them to this subject. Why have they rolled up their sleeves and got involved in improving access to healthcare? And they're going to give us some concrete examples about how we can reach those goals. As I say, the chairman is going to be joining us live at the end of the meeting to draw together the threads of our conversation. But please do make a contribution too. You will see that we've got a QR code at the bottom of the page. All you need to do really is to log into that, scan the QR code, and you go straight to our comment section. Alternatively, you can, if you prefer, log into slido.com. And then all you need to do is to get through to the comments section. There it is, the QR code. It'll take you straight through to the comments. Otherwise, you can use Slido. And can you see the number just above the QR code? If you pop that number into slido.com, it will take you into our meeting. So I'll give you a moment now just to do that, just to connect with our comments platforms so that you can be a big part of this meeting too. Are you ready? Well, let's get going then. I'm pleased to say that our first speaker is the Health Minister of Malaysia, His Honourable Dr. Khairi Jamaluddin. He's going to give us some words of welcome and a sort of way of framing our discussion. And also, Mr. Khairi, I should tell you, is Vice President of the World Health Assembly. He sent us the short message from Kuala Lumpur.
Thank you for inviting me to Roche Global Live Talks. And thank you to Christoph Franz for inviting me to deliver the short message for this event titled, Where You Live Should Not Determine If You Live, Improving Access to Healthcare. First of all, allow me to congratulate Roche on celebrating your 125th anniversary. Your commitment to continuously look at measures to enhance health through science and technology, to invest continuously in research and development, and to solve some of the more pressing healthcare challenges is commendable. Well done, and I wish you continued success. A healthier future is an aspiration that all governments in the Asia-Pacific region strive for. I've just returned from attending the APEC Health Ministers meeting, and we have committed our ministries to strengthen global and domestic preparedness for future pandemics through international and regional collaboration, as well as partnerships to improve the health and wealth of people in the region. We have agreed that healthcare is an investment, and it requires a multi-sectoral, whole-of-society approach to future-proofing our healthcare systems, regardless if it is to face a pandemic or if it is to face the NCD epidemic. It must be an inclusive system that communicates with each other, be it between governments and citizens or between the public and private sectors. These topics are key priorities for my Ministry of Health, for fellow policymakers, and for governments around the world. In Malaysia, we are plagued with similar issues as other health systems from countries in this region. While the focus has been on the COVID-19 pandemic, we have also seen the impact of the NCD epidemic. The Asian community is a population with multiple risk factors and morbidities, such as obesity and diabetes, and now is a growing aging population in many countries in this region. In Malaysia, 7.3% of the population are now 65 years and older, and this syncs with the United Nations definition of an aging society. Mental health issues are also of increasing concern, and multiple factors, including the effects of the pandemic, have exacerbated this. As a global community, one key takeaway from the COVID-19 pandemic is the need to future-proof our healthcare systems. And this means anticipating, preparing for, and mitigating the likely acceleration of the forces we are seeing today. Access to healthcare and future-proofing healthcare is a today for tomorrow investment in our people and an investment in our future as a nation. In line with this, Malaysia is currently developing a health white paper with the aim of further strengthening our country's health system holistically and make it more accessible and more equitable, so it doesn't matter where you live, you will get a world-class healthcare system and delivery at your disposal. Proposals and findings from research from within the healthcare system, as well as extensive stakeholder engagement that I'm currently doing, both within the government, private sector, civil society, and in the community, will be incorporated to ensure that our healthcare system in the future is well-funded, well-invested, and is accessible to as many people, to everyone in Malaysia. It is expected to present solutions in terms of reform strategies on the service delivery, governance, and organization. Our way forward should be a shift of focus from sick care, which it is right now, to healthcare and wellness. What I want to do is to keep 10 million more people healthy over the next 10 years. Technology and innovation are also integral in future-proofing our healthcare system. Greater adoption of digital technologies, not only for remote consultation or outbreak surveillance, but also for precision medicine, for self-health monitoring is needed. For instance, we have expanded the scope of MySejahtera, our digital COVID-19 platform, to include national immunization records for babies born after the 1st of July 2022, and to store health screening records of all Malaysians. In time to come, we hope that we can further expand to cater to the demands that arise with new technology and new disease burdens. But the most important thing, of course, is to ensure that with technology, with digital innovation, no one is left behind. So we have to make sure that there is enough coverage, that everyone has access to the technology, that everyone benefits from the technology. In conjunction with the announcement of the Health White Paper, we had a summit recently that brought together the healthcare community to discuss the way forward. I have acknowledged, for instance, the constraints in resources that the public healthcare system faces and have highlighted that we hope for public healthcare spending in Malaysia to be increased to 5% of our GDP gradually over the next few years. We hope that with this contribution, as well as sustainable and equitable healthcare financing, health systems can be more robust, resilient, equitable, and accessible. The Malaysian Ministry of Health is also beginning to play a greater role on the international stage. In May, we were elected as the Vice President of the 75th World Health Assembly, and we were also confirmed as the Vice Chair of the WHO's Executive Board for this year and next year. We are also leading the way in talks internationally about behavioral insights, having established a behavioral insight unit where we will conduct research into instilling behavioral changes to our people in promoting healthier lifestyles and also by making healthier choices. We also hope to pass the first generational endgame legislation so that we ban the sale of cigarettes to people who are born after 2007, therefore cutting out completely smoking for a new generation of Malaysians. Finally, it is paramount to accelerate our recovery from the aftermath of the pandemic, and much support is needed from the private sector, the public sector, from civil society, from the community, in ensuring that health remains the priority post-pandemic. My government will strive towards a healthier, safer Malaysia and contribute towards a healthier and safer region. We will revive our people's health, safety, and well-being. Most importantly, we will treat healthcare as an investment, and we will make sure that it is equitable and accessible to all. And I will join you and many others in striving to make sure that it doesn't matter where you live, for you to be healthy and for you to live a great life. Thank you.
Mr. Khairi, the Health Minister of Malaysia then. What a powerful address he gave us, didn't he? All sorts of bold pledges there. And Malaysia has an ambitious plan to widen access to healthcare, make the investment today for tomorrow. One of the points I picked up on, I was also very struck by what he said about digital technologies, using digital technologies and smart thinking to widen access. And let's hope we are able to dig into some of those points in the course of the conversations to follow. Before I go back to introducing you properly to our advocates, let me tell you that we've got people, viewers dialing from all around the world. I've just received a message saying that there are viewers joining us from Oman, from Australia, from Nigeria, from Sudan, to mention just a few. Now, would you like to start the conversational ball rolling, as it were? Let's cross to Islamabad. Our first healthcare champion is Muniba Masari, who joins us live from Islamabad. Muniba is hello there, Muniba. She is a national ambassador, a goodwill ambassador for UN Women in Pakistan. She's also, now let me see if I get this right, an artist, an activist, an anchor, a model, a singer, and a motivational speaker. That's really impressive, Muniba. Tell us your story and what's brought you to become a healthcare champion.
Thank you so much, Nisha. Well, this conversation about basic healthcare access is very close to my heart because I have experienced personally the lack of basic infrastructure and lack of healthcare access. 14 years ago, I was in a horrific car crash. My car fell in the ditch, and this accident happened in a far-flung rural area of Pakistan where there was no first aid, no ambulance, no emergency services, no basic healthcare access. So when the people in the local area, they saw me that I was stuck in the car, wounded, they just wanted to save my life because waiting for the ambulance would have costed my life. So all these people, they just tried to save me. So they came for the rescue. They did not know how to do it. So they dragged me out of the car. And because of that, my spinal cord destroyed completely. And I ended up in the wheelchair for the rest of my life. As I said earlier, that there was no ambulance. I remember 2-3 men, they just lifted my broken body and they just put me in the back of a Jeep and I was rushed to another city to get one ambulance. I mean, speaking of lack of basic infrastructure, here I am sitting in the wheelchair with the complete transection of the spinal cord.
Wow. So you have a very personal motivation to get involved in this and to improve access. Muniba, I look forward to asking you more and hearing more of your experiences and your goals. We're now going to cross live to Los Angeles and join Apple the App. He's a founding member of the Black Eyed Peas, the Grammy Award-winning pop and R&B group. Hi there, Apple. You may be familiar with some of their songs. I Got a Feeling, I certainly know that one, and Where's the Love? So, Apple, how did you get involved in this area of healthcare? Tell us your story.
Thank you for the introduction, Nisha. Thank you for having me here tonight. And my name is Alan Pineda Lindo from Angeles, Pampanga, born in Philippines, and adopted as a kid, brought to the U.S. at the age of 14. And not a lot of people know that I am legally blind. I was born with a rare condition called nystagmatism, which is the involuntary movement of your eyes. And, growing up, I really had a difficult time just doing normal things, playing sports. And even in school, I literally had to get up to read the board and jot down the lectures. And luckily, my mother discovered a program, a foundation called Pearl's Buck Foundation, where they support abandoned Amerasian kids that are left in the Philippines. So I was qualified, and you get a sponsorship from the U.S. You've probably seen those commercials, send 75 cents to a kid in the third world country. So I was in one of those programs. And in return, you get to say, you get to write a thank you letter to your sponsors. And I would tell my life story to my dad and, telling him that I'm having trouble with my eyesight. I cannot read the board, and I'm sorry for my math grade and all my grades. And that sparked the initial of having my vision checked by American ophthalmologist. So he brought me to the U.S. in 1986 and brought me to the top ophthalmologists around the country. But unfortunately, if we found out it was too late for me to be operated on, I needed to be under 7 years old. And during my time in the U.S., I just took the chance of asking him if I could stay longer or if he would adopt me. And 3 years later, he processed the papers and he adopted me, brought me to the U.S. And the first person I meet, which is my bandmate, Will.i.am, and we started the Black Eyed Peas together. and I got to pursue my dreams, get an education. Also, found aid into schooling because of my eyesight, and became a Black Eyed Peas. We toured around the world on big stages, and I'm very, very lucky and thankful. So, in 2014, I started the Apple Foundation to provide opportunities to kids like me, uh, uh, and I believe that no child should be left behind. Um, Everyone should have an equal access to health care. And it's very simple. I was given the opportunity. I'm paying it forward to give back and help the youth in the Philippines. Thank you very much.
Thank you, Apple. That's really a very moving personal story. And I look forward to hearing more about how you think we can make it happen. We're going to now cross over to New Delhi and join Dr. Ratna Devi. Now, she is a medical doctor. She's practiced for a long time, but about 10, 12 years ago, she set up an organization to lead a patient's advocacy. What's that about? Let's find out more. Dr. Ratna, what motivated you to switch sides, as it were, and the doctor who advocates on behalf of her patients?
Thank you, Nisha, and good morning, good afternoon, everyone. I was very struck by one message that the Honorable Health Minister gave. He said we should move from sick care to wellness. And I strongly believe in that because I've been a practicing doctor for most of my life. In fact, most of my family are doctors, and we all did what all doctors do, write prescriptions and give orders to patients and tell them what to do. However, in December 2010, when my father was diagnosed with buccal cancer and was admitted for surgery, this changed my life forever. The surgery was successful, but 24 hours later, we nearly lost him to a cardiac arrest. In those 24 hours, we knew something was not right, and we tried to connect with his healthcare providers and the doctors in the hospital, but nobody would listen to us. We then had an important realization. We were families and caregivers of the patient, and our concerns were just seen as those from an anxious family. The cardiac arrest could have been prevented, and I understood how important it is for patients and caregivers to be heard. 2 years later, I had the opportunity to attend the Global Patient Congress organized by the International Alliance of Patient Organizations in UK. There, I heard thousands and thousands of patients doing exactly the same thing that I wanted to do in India. And that motivated me to set up my organization, Dakshima Health. We are now the secretariat of the Indian Alliance of Patient Groups, a 60 plus cross disease patient organization that brings the patient voice to the policy forum. And we are very happy that we started this journey. I've never looked back since, and it has been an extremely rewarding and fulfilling journey. We have worked to build capacities and shape policies.
Thank you so much, Dr. Ratna. Now, before we go on, can you see that we've got a question up there? If you're health minister for a day, what would you be channeling your time and funding into? Well, that was a question that we put to all of you in a poll before our meeting. And this is how you responded. Shall we take a look? Well, as you can see, there are no clear-cut answers. I think universal health coverage and education and prevention were pretty much neck and neck, and together accounted for about almost 70% of your views. And so that's where we're going to be focusing on our conversation. But if you do want to talk more about training doctors and nurses, send me a message. If you do want to talk about the need to build more hospitals, please let us know. Let's see what our health champions make of that. I'm going to ask them now, if you were health minister for the day. Remember, we heard from that very powerful health minister at the start, Mr. Khairi Jamaluddin, and wasn't he bold? Well, what would you be putting your healthcare budget into then? I'm going to ask you, who should we start with? Dr. Ratna, since you've got a medical background, what would you prioritize?
Okay, Nisha, I think prevention and education is important to reach that goal of universal healthcare. So I would really focus on education and prevention. And when I say education and prevention, it means education of patients, caregivers, regulators, policymakers on what patient empowerment and participation means so that they can be included in all conversations. And this would lead to prevention as a healthcare policy by increasing awareness around risk factors and healthy behaviors because that is the only sustainable approach to universal healthcare. So I think that's the best way to move forward. Use prevention and education to achieve universal healthcare.
Excellent idea, and it's also very cost effective, isn't it, Dr. Ratna? Muniba, your thoughts if you were health minister for the day?
Well, if I become a health minister, hopefully so one day, definitely universal healthcare access will be my ultimate goal, and I will ensure that no one is left behind. And being a health minister, I want everyone to understand that basic healthcare access is not a luxury, it's a necessity. If government is giving basic healthcare to its people, it's not a favor, it's their basic human right. As a health minister, I will ensure that the basic infrastructure is sorted so that if someone cries for help, emergency services can reach there on time and save their lives. And then also, I will ensure that all those rescue teams are fully equipped and are trained how to rescue someone because slightest of the negligence can destroy someone's life. And I would never wish anyone to go through what I have been through personally. And last but not least, being a woman, I would like to talk more openly about breast cancer awareness because speaking about breast cancer in my society is still a taboo. Women, knowing that something is abnormal with their body, they hide that. And because there is no early detection, no free screening, women die of this cancer.
I'm going to ask you more about that in a minute, Muniba. I've written it down. Apple, may I ask you the same question, though, first? If you were health minister for the day and not a musician, what would be your priorities?
All right, if I was a health minister for a day, I would focus my attention in treating preventable blindness. I would train more doctors and healthcare workers